Very informative, very informative. Cari, Cornerstone Montgomery.
Yes, Cornerstone Montgomery.
Tell us about your organization.
Okay, well, as you mentioned, we are a merged organization. 3 years ago, Threshold Services and St. Luke's House, both primary behavioral health providers in the county, decided to merge. And we basically did that because we wanted to really position ourselves for healthcare reform. We wanted to provide better services to our clients. St. Luke's House had been around for about 40 years, and Threshold Services had been around for about 30 years.
And what did St. Luke's, what was their major function, or
Well,
those two organizations?
Really, both organizations had a very similar mission. So we came together, and now, as you may know, that there were 1 in 4 adults in the country will experience a mental illness in any given year.
Yes.
And 1 in 17 of adults in this country will have a severe mental illness. So they'll have schizophrenia, bipolar disorder, major depression, and half of those will have also a co-occurring substance use disorder. So what we do is we provide a variety of services to those folks, to the people with severe illnesses. And we have 212 residential beds. We have 3 outpatient clinics where people get medication.
Wow.
Yeah, and treatment. We also have a supported employment program that helps people find, get, and keep jobs.
While I'm thinking of it,
Yes.
do you have a website that you would like to
Absolutely.
identify?
Yeah.
Could you do that?
Yeah, it's cornerstonemontgomery.org.
Cornerstone Montgomery, that's pretty easy.
Yes.
CornerstoneMontgomery.org.
Yes.
Okay,
Yeah.
I'm sorry.
That's
Go
okay.
ahead.
No, that's fine. Our priority is to help the people we serve to live, work, and engage in the community. And we do that through the services we offer. And we also have a priority of education and advocacy. Really, you know, you hear about the shootings in the malls, the schools, and a lot of those folks have been identified as people with mental illness, and most of them weren't receiving treatment. So we want to make sure that we reduce the stigma and discrimination, that people know that those who are diagnosed with mental illness, they're no more likely to be aggressive or violent than the regular population, as long as they're receiving treatment and have access to treatment. So a lot of what we do is try and educate the community about the resources that are out there and about access. And that's a need for advocacy as well, to make sure that the resources and access continue to improve.
And I think that's very important, because I think for most of us, we spend a lot of time and energy learning about how to take care of our bodies, but not of our minds. And I think that sort of gets put aside until it's
Right.
an emergency.
Absolutely.
So that education, it's a big.
Yeah, it's a really important, and advocacy, because if the resources and access aren't there, then we're not going to be able to reduce those incidents and have other things happen. I think, you know, what we try and look at is, you know, what can we do? How can we educate? How can we provide advocacy for that? Funding is obviously a big deal, and mental health, even though it really is a priority, an urgent priority, in the last 18 years, mental health, the public mental health system in this state has only gotten an inflationary adjustment 5 times in 18 years.
I personally and professionally find that incredible,
Yeah.
that we're still talking about mental health as if it's something way out there that we shouldn't be dealing with, as we deal with cancer, blood pressure. It's a medical condition.
Right, and cutting those services or the funds to us is not going to necessarily see a savings, because that means in other areas,
Exactly.
and going to the emergency department, going into the criminal justice system, those services are going to increase. Those homelessness, that's all going to increase. So we have to find the balance somehow.
Right, mental health is a huge issue in the criminal justice system.
Yes.
And we've seen really a deinstitutionalization over the last 40 years.
Right.
And really a shift of the institutionalization from hospitals to jails in many respects. The jails are the biggest providers of mental health services.
In many jurisdictions, absolutely.
And, it's true in Maryland, right. So there need to be more resources in the community for mental health, and we need to find ways to divert people who are committing crimes, not homicides, but more minor crimes, into the mental health treatment system and away from jail.
And Montgomery County, there is a lot of people who talk about this, and we work on this. So it's not something that we're just, oh, ho-hum, this is happening. There are people who work on it. There are programs going on and regular attempts to do that and discussions, but it's just a challenge, especially when the funding is cut. You can't try new things.
So as an example, do you work in collaboration with, say, the Mental Health Association of Montgomery County or different organizations like that?
Sure, absolutely. We work with them. We work with, you know, Community Clinic. Interfaith Works is another program. We have a lot of partnerships even with hospitals. One of the main reasons for the increase in admissions to hospitals is behavioral health problems. So
Absolutely.
they want our help. We want to partner with the hospitals to help decrease that, to make sure that when people are discharged, there's some follow-up, we can support them and keep them from going back to the hospital,
Right.
keep them in the community. But it's an ongoing challenge, and unless you have that collaboration, those partnerships, even working with the criminal justice system, you have to have those collaborations, and that's one of our focuses, and I think we're pretty strong in that.
In the short time that remains, what is your major message you'd like to send to the community? Or
Just
citizens?
to, have an open mind, look into, get some education about mental illness. Don't make the assumptions. Don't fall back onto that discrimination and the stigma. And please look at our website,
Okay.
contact us for information.
Thank you. We'll be back after these messages.